What we are trying to do is to ensure that the cycles of panic and neglect get broken with the COVID-19 response.
On today's episode of Expert Answers, we're talking about the coronavirus, or what specialists call COVID-19. Over the past few weeks, the virus has spread to more than 60 countries and territories, infecting tens of thousands of people and leaving 3,000 people dead. Now this week, as fears have grown about how the outbreak could affect global growth, the World Bank Group announced a massive support package valued at up to $12 billion to assist countries who are responding to or preparing to respond to the outbreak. To hear more about the human cost and the healthcare systems that are under tremendous pressure, especially in developing countries, I spoke to the World Bank Group's Global Director for Health, Nutrition and Population, Dr. Muhammad Pate. Muhammad, let's jump right into it. The bank announced this package valued at up to $12 billion. How can that money be spent effectively?
So this outbreak, as it's unfolding, it's moved from where it was primarily in China to countries that are less strong in terms of their health systems, are more vulnerable to an outbreak such as COVID-19. And the bank's support is really geared to help those countries be able to better detect the virus when it hits their shores, do the case finding, diagnose it, but also equip the frontline health workers both with knowledge, but also with the tools to be able to respond adequately. That will be key to containing this outbreak before it also then gets established within their populations.
Spreads further within the populations. Geographically speaking, where are you most concerned? Where is the greatest need for support and help, both now, but also as this outbreak develops and changes over the coming weeks and months?
There are parts of the world, the virus is all over the world, and yet there are some geographies where it's not really established yet
Yeah.
because they haven't been able to diagnose it, or the virus may not have reached them yet. So those are the areas where we need to support them to prepare before the virus hits them, or if the virus is there, for them to detect
so
where
they
it
can be kind
is.
of best defended against it.
Exactly, and then be able to target interventions so that they can be able to respond adequately.
And on that, the kind of map of it right now, obviously China has been hit hard by it, but it's also in a bunch of high-income countries. If and when it spreads to low and middle income countries, what are the sort of unique vulnerabilities of these countries compared to maybe what we've seen so far?
So this virus, what it's showing us is that even high income countries are not really as prepared as they should be, as we have seen in some of the countries in Europe, but other places as well. But the poorest countries are likely to be more vulnerable to it, in terms of their preparedness, but also the capability of their health systems to deal with the consequences of it. Because not every country is able to stand up a response like China did,
Right.
in terms of even its healthcare system.
And if I'm not mistaken, you were a health minister in Nigeria before, is that correct?
Yes.
What are those countries doing now? What do they need to be doing now to prepare before this virus arrives on their doorstep?
So in Africa in particular, after the 2014 outbreak, several things have happened. In the case of Nigeria, we invested quite a bit in terms of the public health system, but also the management structure. So we developed an emergency operations center, which helped when Ebola came to being. But several institutions have come to being, the Africa Centers for Disease Control, and many national public health institutions have been developed, and the World Bank is supporting them. And that is going to make an important difference when African countries are responding to this.
Let's talk a little bit about that support. Let's get into the details. So I think something that gets maybe a little bit lost beneath the headlines, a lot of people see the money, they see the figure, it's a big number, but the World Bank is also providing technical assistance and technical support. What exactly is meant by that? And I know you're a doctor as well. What would that mean to the doctors and the healthcare workers who are on the front line of this crisis?
So the financing that the bank provides will enable countries to stand up their response plans itself, but train their health workers. That requires ability to adapt whatever WHO has within their country context, but train the health workers to be able to get out there to protect themselves, but also take care of those patients.
One of the other things I was reading about is working to help maintain trust within communities. I understand that has to do with like making sure healthcare workers are safe, making sure communities understand what's going on. Can you explain that a little bit? What exactly? Am I understanding that correctly?
Yes, I think the role of trust is even more important in crisis situation like this. As we've seen in DRC or in West African Ebola outbreak or even in China, where the trust environment is low, people then may not follow the best guidance, the most rational thing for them to do. So engaging communities and citizens to understand what is at stake and to follow the instructions that have been given to them.
And to know that these instructions are in their best interest, I guess.
Yes, and to do that transparently, because sometimes lack of information fuels the distrust, because then people start guessing what is really going on. But if there's full transparency, then people will believe what they're hearing and be able to use that and in the actions that they take.
So
they don't
rumors
hide
aren't
cases.
flying and that
Exactly.
sort of thing. Can you tell me also what the bank is doing to help the poorest patients? So those that are either super remote or maybe are afraid they're not going to be able to afford care during this outbreak.
What we hope to see in the days ahead is countries come up and utilize these resources to respond not only for the overall population, but taking cognizance of those who can easily be left behind, the displaced populations.
So you talked a little bit earlier about the need to build resilience. Beyond the $12 billion package that was announced this week, what has the bank been doing to help countries prepare for this and other big outbreaks over the past few years?
So the World Bank's effort to do this did not start with COVID-19.
Right.
It goes, I say, several years before now. If you go back from SARS to the pandemic flu, to the MERS period, but also the Ebola, there is a track record of experience in the World Bank in terms of dealing with this. Preparedness is a core part of it, and what we are trying to do is to ensure that the cycles of panic and neglect get broken with the COVID-19 response.
Panic and neglect meaning panicking about this outbreak and then kind of neglecting afterwards?
Which is the pattern that has occurred in the past, where when the media shifts its attention, then everyone goes back to their normalcy.
The experts, the funding kind of
What we
goes away.
hope is that investing in core public health becomes central to the work of development and the work that the bank does, because the implication is not only in health, but also has a huge implication on economies and societies.
Dr. Muhammad Pate, thank you so much for your time. We'll have to leave it there. Thank you so much for watching this episode of Expert Answers. The World Bank Group is continuing to monitor the outbreak of COVID-19. If you want to learn more about our work, head on over to worldbank.org. Until next time, goodbye.